Hi, my name is Leslie and my partner Janice will be editing the video. Our topic we chose was the pink eye of death. What we will be going over is a summary of the medical mystery, which includes the story and medical history, the medical terminology, which we will be explaining, the big question, which is what we are trying to get the answer to, and the diagnosis, which is our evaluation. Here's a short summary of the medical mystery. A 30-year-old man goes into an emergency room and complains of a headache and neck pain. He is sent home with ibuprofen and is told it was a tension headache. He returns a week later with red eyes, also known as conjunctivitis, continued headache, neck pain, and nausea. He dies in the hospital shortly after admission, and the case is referred to the medical examiner because the death is sudden and unexpected. The only significant medical history is that he had been shot in the face as a teenager and is now blind in his right eye. The autopsy findings were meningitis, which is a pus-filled infection of the brain with Staphylococcus aureus, a bacteria that usually infects wounds, and pus extending to the gunshot wound tract and around the eyes. So the medical terminology we can get here is ibuprofen, tension headache, conjunctivitis, nausea, meningitis, and Staphylococcus aureus. So, what is ibuprofen? Ibuprofen is a pain relief medication. It is classified as an NSAID, which is short for a non-steroidal anti-inflammatory drug. This is a common over-the-counter drug which can be bought in pharmacies. One effect of the drug is an increased risk of heart attack or stroke, so always be careful around drugs. Our next vocabulary word is tension headaches. Tension headaches are located on the top of the head. Some causes include physical or emotional stress, caffeine, the flu, colds, sinus infections, eye strain, fatigue, overexertion, and dental problems. The next vocabulary term is conjunctivitis. Conjunctivitis is the medical term for pink eye. This usually is caused by the inflammation of the outer layer or the inside of the eyelid. There are a few causes for pink eye. These include bacteria or viral infection, allergies, irritation, or contact lens products, eye drops, or eye ointments. Common effects include swelling and itching. Our next term is nausea. You have probably heard about nausea before. It is an uncomfortable feeling in your body that makes you feel like you need to puke. Some common causes are morning sickness, motion sickness, migraines, food poisoning, some medicines, and
intestinal obstruction.
Our next term is meningitis. Meningitis is the inflammation of the thin tissue that surrounds the
brain
and spinal cord. There are different types of meningitis: bacterial, fungal, non-infections, parasitic, subacute, chronic, and viral. Lastly, we have Staphylococcus aureus. Staphylococcus aureus is a type of bacteria. This type of bacteria causes most infections like skin infections and bone infections. Sometimes Staphylococcus aureus can even be found in food poisoning. So, this would bring us back to our big question that we have. Is this a delayed homicide or a natural death? While digging into this medical mystery, we believe we have come up with the diagnosis for what may have happened. So far, we think that this may have been a delayed homicide. The reasons why could differ, but so far, we think that it could have possibly been a bacterial infection that had spread to where he had been shot as a teenager, and or it could have been a critical brain injury that he had been carrying with him this whole time but had gone unnoticed until a few years later. Lastly, here are the sources that we used for our information on these slides. Thank you very much for your time.